Okay, there we go. Hi Yvonne, how are you?
Michelle, welcome back for another session of After Physio. Thanks for joining us once again.
Delighted to be here. Great. I'm looking forward to today's conversation. Very timely for the week that's in it.
Absolutely. Happy Valentine's Day to you.
And to you. And to you.
We put out some questions there, or a questionnaire to our customers and our community, and we got a number of questions. And we're going to ask the 4 here in total that we would actually think they represent an awful lot of the questions that we've seen.
Great.
We'll get straight into it, Michelle, if you don't mind.
Let's jump in.
Okay, brilliant. The first question is, I'm 18 months post-op. I had a front and back repair, pelvic floor repair and hysterectomy.
Okay.
Now I fear and dismiss sex. I'm frightened of doing Zumba. Can you help me?
Oh, yeah. I mean, this is just reflective of so many women that I've talked to over the years. And you know what, I teach all over the world, and it's an international story. You know, women are just left wondering what can they do to get their lives back. So there's a couple of different things within that question that I think we need to just tease out a little bit. So she's had a hysterectomy, and it'd be interesting to find out if she had her ovaries removed at hysterectomy. Because if the ovaries are removed at hysterectomy, you're basically waking up in menopause. You know, instead of that nice gradual transition that we would normally have, it's like, here you are, you wake up, the hot, you know, potentially the hot flashes and everything else that's going on. And the thing is that when the ovaries are removed, that you lose a lot of your estrogen producing capacity. And estrogen is responsible for about 400 different functions in the female body. But it's very important for libido, for sexual drive, but also for producing lubrication during sex. There's lots of other implications as well in terms of bone health and brain health, and particularly heart health after hysterectomy when the ovaries are removed. Even if the ovaries are kept, you know, 50% of women will go through premature ovarian failure. So they'll have their menopause a little bit faster and maybe even a little bit harder than they would have had normally. However, the good news is, that's the dark news. The good news is with, you know, we can talk about topical estrogen that works really nicely and is a lot safer than say maybe taking oral hormone therapy. So topical estrogen can be applied in and around the vagina. But sometimes, to be honest, all it takes is, you know, go see your women's health physio who'll be able to talk to you about how to use lubricants properly for sex.
Okay.
If she's had an anterior and posterior repair, then there could be some trauma to the pelvic floor muscles themselves. So again, a good women's health physio will be able to assess externally and internally and to advise about how to rehab the muscles properly to deal with any maybe scar tissue that's in there. Maybe the nerves are a little sensitized. From a libido point of view, we have actually got some nice research showing that exercise is a great way to enhance libido. Researchers like Herbenick even talk about exercise-induced orgasm or exercise-induced sexual pleasure. Because your pelvic floor muscles are responsible for so many things. We know for back pain, for avoiding back pain, for keeping control of your bladder, your bowel, but they're also responsible to a large part for the female orgasm. So if we're talking about penetrative intercourse, the superficial muscles, so the outside muscles in your pelvic floor, have to be able to relax enough. But the internal, the deeper muscles in your pelvic floor have to be strong and coordinated enough to achieve orgasm and sexual pleasure, because the female orgasm is essentially a series of rhythmic contractions of your pelvic floor muscles, 0.8 of a second apart. The other thing is that, you know, pain is obviously going to have a huge effect on sexual drive. You know, and just sexual enjoyment for women, you know, this is women's most important sexual organ here, the brain. So I would say she's got to look at how can she enhance enjoyment and sensual pleasure in everyday life. You know, is she enjoying her life in general? Is she exercising? Is she eating well? Is she sleeping well? What is she doing for fun in her life?
Yeah.
Because you can't just go from 0 to 60 with sex. And I would say if you go see a good women's health physio who has some experience in sexual health, she'll be able to point you in the right direction. You know, sometimes just a little bit of education about using vibrators can be really helpful as well. And just kind of reintroducing your sexual self by yourself, first of all, before you try to involve a partner, can be really helpful. And then, you know, there are lots of ways to connect intimately with a partner that don't have to involve full intercourse as well. So things like sensate focus can be really helpful, where you're just, again, reestablishing intimacy and touch and pleasure. So I would suggest, you know, she starts off, is she exercising? Is she eating well? Is she sleeping well? What's she doing for fun? You know, going for things like massages, going for a walk on the beach. So again, looking at energy in before she starts looking at energy out again. But I think a good women's health physio would be really, really helpful in this situation, because she's going to be able to do a complete assessment of her, you know, body and mind, and see what's going on, and then really work with her to come up with a strategy so she can start to regain that aspect of herself again. Because, you know, it's not just, it's about, you know, having that aspect of yourself available again, and being able to enjoy it and get your life back, because it sounds like she's been through a lot with both the repair surgeries and the hysterectomies. So she really, you know, I think would benefit from a good physio assessment.
Absolutely. And you know, even, you know, now I fear and dismiss sex, and I'm frightened of doing Zumba. There's so much fear there.
I know.
You talked earlier on there about the brain being so important.
Absolutely, it's key. And if you're worried about it, you know, what happens is then the pelvic floor muscles are very psychologically responsive. So if you're worried about sex, the pelvic floor muscles are going to be very, very tight. And then that fear and tension means she's not going to be producing any lubrication herself. So sometimes it's as simple as having the reassurance of using a good lubricant, you know, something that's not going to irritate the tissues down there that can be a little bit delicate. So something like Yes, which is a lovely organic lubricant. It doesn't have any of those endocrine disruptors. I would tend to stay away from things like KY. But something like Yes lube, it's organic, it's got no phthalates or parabens or any of those endocrine disruptors. Just to remember that oil-based lubricants will not be compatible with condom use. So if condom use is an issue, make sure that you're staying more towards the water-based types of lubricant. That would be important to remember. But again, you know, a physio will be able to sit you down, teach you how to apply the lubricant, you know, to really look and see what's going on in terms of spinal health and hip health as well, because sometimes ergonomics or positioning can be a factor as well. And to really take a look at the whole person standing in front of them, and allow them, you know, just to start working together to get a path back to sexual health.
That's amazing, Michelle. I mean, what the pelvic floor is responsible for is unbelievable.
Everything.
But, you know, but again, it comes back to what we always talk about, in a sense, not to be afraid to ask the question.
Absolutely.
Good women's health physio.
That's
and
the key.
we've heard it all before, and what an important aspect of life, you know.
Absolutely.
And what she's missing out on, but the hope that, you know, the great news is there.
Yeah.
You know, ask the question, and you'll get the information out there, and you will get back, you know, back out Zumba and having enjoyable sex again.
And again, Zumba is a great way to kind of get back into your body again, you know, the music and the dancing and that community, you know, when you go to a group exercise class. So, you know, wearing maybe some compression garments, you know, like EVBs, great way to just give her that sense of security so she can actually go out and enjoy herself. And again, energy in before energy out again, I think is really the message with that. But it's about finding something that you really enjoy doing for movement, and that's a big step towards regaining that aspect of health.
Absolutely. And Michelle, when you talk about the fear there and the tension build up, which naturally would cause overbracing and stuff, and
absolutely
to kind of settle back down, relax, and breathe. Actually, Michelle, you're a great woman for recommending us to breathe. The simple little things, those little nose exercises you gave us earlier on in the year or last year. I mean,
simple things make the world a difference, you know. And again, just, you know, to maybe talk to a physio about, you know, just the best avenues for just getting your body and your head working together. Because if you're worried, as you said, or you're tense or you're stressed about it, you know, that's not a great start to any encounter of that nature. So it's really important that you're relaxed, you're at peace with yourself, and that you're not fearful of what's to come when it comes to sexual experiences. And I think a good women's health physio will be able to give you those tools, as I've said, whether it's working with a dilator or a vibrator, or talking to you about lubricants or positioning or different things like that, because a physio will be able to kind of, as I said, look at the whole picture and come up with a plan and work with you to get where you need to be.
Brilliant, Michelle. Great, thanks a million.
Of course.
Okay, we will move on now to number 2.
Okay.
This question is, I can't orgasm since I've had a baby.
Yeah.
Can this change?
Yes.
Okay.
Yes would be the short answer. Again, I would say this would be a situation where having a good in-depth conversation with your women's health physio would be a great way to go, because there could be a number of different factors causing the problem there. Lots of women, after they have a baby, particularly if they're breastfeeding, have lower levels of estrogen, as we've said, and that is going to influence your ability to produce lubrication, to reach orgasm, to have sexual drive. So she might need to work with both her physio and with her GP or gynecologist, to maybe look and see what the hormone levels are doing. It could be a matter of, again, just using a good lubricant, as we said, like Yes is the one that I most commonly recommend. And you can get that in health food shops. You can get it in pharmacies. If you're in the UK, you can get it on prescription from the NHS. It's very widely available. It could be due to maybe some scar tissue. Maybe she had an episiotomy. Maybe there was some trauma to the pelvic floor muscles. That could be a fear factor. It could be that she's not sleeping well. It could be that the pelvic floor muscles either need strengthening or they need down training and just to relearn that coordination. It could be a million different things, but the answer is almost always yes, that it is absolutely a possibility, a probability that aspect will come back to her again. But sometimes it's like anything else, you just need a little bit of help to get from A to B. And that's where really doing a good in-depth assessment is absolutely vital. When I'm teaching courses to physios and to doctors and midwives, what I will always say is that if you do a really good assessment of the woman in front of you, the treatment planning is actually fairly straightforward in the clinic once you've got your clinical reasoning skills. But it's to spend time to listen to the woman's story, take a really good history, and find out what her goals are, and then to do a really good assessment so that you're working together to come up with a plan to reach that particular woman's goals. So absolutely go, find a good women's health physio who has some experience and training in sexual health as well as in obstetrics and gynecology, and I'm sure she'll be able to help you.
That's brilliant. That's great news, Michelle. We've got another question here. If someone has seen a psychologist and their family physician and a pelvic health occupational therapist internally and is still unable to achieve orgasm, what would you do next? What are your thoughts on touched out syndrome?
Yeah. Touched out syndrome is so common and is not talked about enough. So touched out syndrome, very common in mums who've just recently given birth and who maybe are breastfeeding or who are sleeping with the babies and baby wearing all the time, and literally there's too much energy being given out. People are touching them and wanting things from them all the time, so that actually when it comes time for sex with their partner, there's nothing left in the tank. They have nothing left to give, and it just feels like somebody else asking for something from them. So this is really a classic case, again, of energy in before energy out. I would say, if she's seen, it sounds like she's seen a pelvic health occupational therapist, which is great. I would say it could be worth your while going to see a women's health physiotherapist, just because they will have extra training in spinal and hip and lower extremity knowledge, just to rule out anything else that's going on. But it sounds like they've seen a couple of different mental health and as well as physical health professionals here. So I would say this would be a really good time to focus on extreme self-care. Are you eating well? Are you sleeping well? Are you getting out for some exercise by yourself? Is there any way that somebody can take care of the baby so you can go out for a walk by yourself? So you can just shut the door and be in a room by yourself and do some breathing exercises, some mindfulness or some meditation. So you can really start to put energy back into your system, so then energy can come back out again.
Amazing, Michelle. You know, yeah, we've written a couple of blogs there. You know, it's about self-care, and when you give yourself back that little bit of time, everybody will benefit from that.
Well, do you know something? Like I travel a lot for work, and the first thing they tell you when you get one of the first things they tell you when you get on a plane is that you have to put your own mask on before you help anybody else with theirs. Yes. And it's the very same thing here. You have to put energy in before you can take care of anybody else. And you know, we both know when you have a small baby or a child to look after, it's constant energy out, especially in those first couple of years. And you know, if you're breastfeeding and everything else is going on. So again, maybe go see a good women's health physio again, who'll be able to talk to you about, you know, just even advise about vibrators, and really looking at maybe some solo self-pleasure first of all before you start to involve a partner again, and to start to reclaim that sexual side of yourself. Because if you're taking care of everybody else 24/7, there's nothing left. There's nothing left in the tank. So you have to refill yourself first. And for a lot of women, that actually involves just having some time to yourself. So you're just reading a book, or like I said, going for a walk, or just sitting in a room by yourself and doing some breathing, or watching something on television even. You know, it doesn't have to be terribly intellectual or high-minded, but just to have that time for yourself so you can start rebuilding your own reserves. That seems to be the best strategy that I've come across for touched-out syndrome. And
wow.
This too shall pass. You know, they say with small children, you know, it's exhausting when you're in the middle of it. But you know, the days are long, but the years are short. So it will get better.
Absolutely. Oh, that's great news, Michelle. Thanks a million.
Yeah.
And our last question is, I had problems with my episiotomy scar, pelvic floor pain, and pain during intercourse.
Yeah.
I've had physio and steroid injections, and it appears to be getting better.
Good.
I want to lose weight in a safe way.
Okay.
I'm getting mixed messages about what is safe for the pelvic floor.
Okay.
I swim and walk and do aqua aerobics.
Okay.
I'm looking to do something higher intensity.
Yeah.
And she asks, is spinning okay, or what other activities would you suggest?
Okay, so spinning possibly would not be my first choice, only because if she's got tenderness in the pelvic floor muscles and around the episiotomy scar, sitting on a bike seat might not be the best for her. I would say if she's in Ireland or the UK, you know, to find a holistic core restore coach, because you know Jenny Burrell, you know, who's the founder of Holistic Core Restore, and she's trained Holistic Core Restore coaches to really look at pelvic floor safe and pelvic floor healthy programs that have that element of high intensity interval training, which we know is so healthy for cardiac health and for building endurance and fitness and fat loss, which a lot of women are really focused on, you know, once they're ready to get their bodies back, you know, after having a baby. So that would be the first thing I could do. A lot of the Holistic Core Restore coaches will do Skype consults or online training as well, so she can incorporate that into her schedule, you know, they're having to travel maybe. It's all about removing the barriers towards health and wellness. Wearing EVB shorts could be a good kind of, again, extra layer of compression for her, just to give her that support around the pelvic floor and the lower back. I would hope that, you know, she's working with the physio, she's doing a little bit of scar massage herself on the episiotomy scar, because that's really, really helpful in terms of restoring blood flow and just desensitizing the area as well. Using a good lubricant, again, very important with that too. But in terms of exercise, any exercise almost can be turned into high intensity interval training. You can be going for a walk and you can speed up the walk and then slow it back down again. So you walk really, really hard and fast for 30 seconds and then you dial it back for 15 seconds. She could swim really hard for 30 seconds and then dial it back for 30 seconds. She could go up the stairs, you know. Anything can really be turned into high intensity interval training. And, you know, it's really important, I think, that we remove all these barriers. So it's not a matter of going to an expensive gym or having to have a certain piece of equipment. It is about moving often and regularly. You know, the recommendations are we have about 150 minutes a week of moderate intensity exercise. So that means that you're exercising hard enough that you'd be able to talk, but not able to sing. Okay, so you can just about sustain a conversation while you're doing it.
Yeah.
But almost any exercise, as long as it's pelvic floor safe, that's always my proviso. So you're not leaking with it, you're not having any pain with it.
Yes.
Those are kind of my two big criteria. But apart from that, almost any exercise can be turned into high intensity interval training. Just make sure that you're not having to breath hold for it as well. So say if you're going up and down stairs or if you're lifting weights, it's really important from a pelvic floor friendly point of view that you're able to breathe through it. Well, you're not holding your breath to brace, because that can cause a lot of downward pressure on the pelvic floor that's already, it sounds like, been through a little bit of trauma already. But it sounds like she's moving in the right direction. She's in a good headspace. She wants to move forward with exercise. I think talking to your physio as well about what's available in the area and maybe tailoring an exercise strategy that works for you, so it's customized for you. But I would say also reach out to one of the Holistic Core Restore coaches, and I'll put a little link underneath our chat here, and folks will be able to connect with one of those there if they have one locally.
And Michelle, do those Holistic Core Restore coaches do Skype, talk conversation, almost one-to-one classes? Do they do that?
Absolutely. Yeah, I mean, I've been working with Jenny for years now, and you know, we're very committed to excellence when it comes to women's healthcare. So I'm the clinical consultant for Holistic Core Restore, and I have to tell you, these coaches are so tuned in to women's health and getting women moving well and eating well, and you know, just really taking care of themselves. Because you know, again, for the week that's in it with Valentine's just having gone by, it's important to remember that heart disease is the #1 killer of women, you know, more than all the cancers put together. And we need to have more awareness of what heart disease looks like in women as well, because it can manifest differently in women. You know, women, particularly older women, might not get the crushing chest pain. It could be upper back pain, it could be jaw pain, it could be insomnia, it could be anxiety, it could be feeling very gassy or burpy. Women don't tend to respond as well to the conventional treatments. We tend to get a different type of heart disease. So we know that the best way to deal with this is to prevent it in the first place. And you know, the 4 big pillars for women and heart disease are movement, how they're eating, what they're eating, their stress management, and their sleeping patterns, really important. So if you can get those 4 right, you're really on a good path towards heart health. But unfortunately, we know that pelvic health issues like bladder leakage or pelvic pain, pelvic floor dysfunction is a barrier in the female population, about 50% of women participating in exercise. So we really have a lot of work to do to make sure that women are exercising well, but in a pelvic floor safe and a pelvic floor healthy way. And that's why I'm really pleased to be working with you and with the Holistic Core Restore coaches, because you know, the benefits not only for heart health and pelvic health, but bone health and brain health and mental health and weight management. You know, it just, the ripples keep on going with healthy movement and healthy eating. So it's we have a mission to help women live well.
Absolutely, and I had the pleasure of meeting a lot of those Holistic Core Restore coaches over the years.
Absolutely.
An awful lot of them actually are there because of why we're here. Why, you know, I mean, personal problems, personal pain, understanding, you know, what's out there, and realizing, hang on, the conventional way, we need to change this, make things more pelvic floor safe.
Exactly, but very functional as well, you know. And again, put some fun into functional too, you know, because you want to. It's all about enjoying life and having that quality of life as well as the quantity of life, hopefully.
Absolutely, Michelle, this has been really an eye-opening. I've learned an awful lot once again. I love these chats that once a month, and I look forward to touching base with you again. Thank you so much for your time.
Perfect, a pleasure as always. I'll talk to you soon.
Take care, Michelle. Bye-bye.
Bye for now.
Bye.